Hi. Recently I got a question from a YouTube subscriber, which was nice because it's nice to be able to answer some questions about transition stuff because that's exactly why I made this channel. And the question was in regard to HRT and my roughly what my timeline was for it. And I thought that this is definitely something that not just the person who asked this question for could benefit from, but anybody who's going through transition, uh, specifically male to female transition. I think it would probably be pretty beneficial. So roughly, my timeline was I had sort of a big life event, like a cancer scare that finally took me out of the closet after a really long time. And I needed to get on. I decided that I accepted that I was transsexual, and then I decided that I needed to get on hormones. Um, and I saw a therapist, an online therapist, which I really don't. Uh, I don't recommend that you look for a therapist online, and I'm not even sure that I recommend that you look for a therapist just generally, unless you live in a country that's quite progressive. Maybe here in the Netherlands it's okay, but if you live in like the US or maybe even in Canada, I'm not sure it would be that good. Maybe in Canada it's okay, but maybe in some parts of the US it's okay, but like if you live in like Singapore or something like that where it's not very progressive, I'm not sure that it would be a good idea to seek out a therapist in order to get on hormones. Um, Anyhow, I found a lot of my information when I started out from susans.org. And actually they say they have a lot of misinformation there, or if not outright misinformation, it's certainly very US centric. For example, the thought that I had, which was that it would it would take a referral from a therapist before I could be prescribed hormones, and that wasn't true. In Southeast Asia, you can just go to any pharmacy and you can just get pretty much any medication that you want. You certainly can buy Xanax, Rivotril, Valium, all the benzodiazepines there, and you definitely can get estrogen and spironolactone. Spironolactone. I'm not sure about testosterone, but probably. I don't know though. That's from my experience in Cambodia and Thailand. I also ended up traveling to Malaysia um, to get a health check and to get a doctor to prescribe me hormones. So I actually had a therapist referral and a prescription for hormones, but in the end I just ended up buying them at the store um, without any sort of prescription at all. So definitely do check how things relate to you and where you are, because something that some people are saying applies to people in the US doesn't necessarily apply to you in your country. And that's what I found. A lot of the information I found was very US centric and just didn't really apply at all to what was happening in the other parts of the world. In fact, my therapist at the time, my online therapist, was like, oh, you have to have a referral, blah blah blah, and recommended that I contact the Suporn clinic. Dr. Suporn does transsexual surgeries and is like world famous for it, considered by some to be the best gender reassignment surgery uh, uh, surgeon in the world. And their assistant sent me an email saying, oh, you should just buy it over the counter and do it yourself, and it's fairly safe. And that just went totally against what a lot of the people in a lot of Americans will, health professionals in the U.S. or even Canada will tell you, is that taking hormones without a prescription is dangerous and blah blah blah. But the attitude from other people is that that's not the case. In any case, I did want to be very careful about it, so I also contacted an endocrinologist who specializes in transsexual studies at a major university in Canada. And I had him do a remote session with me and then give me some advice on what to do. And his take as well was that for somebody who's reasonably young and doesn't have any pre-existing complicating conditions, it's male to female transsexual hormone replacement therapy is quite safe. So I don't know, I'm not a doctor myself, but that was my experience with getting onto hormones and the health professionals that I had to deal with. In any case, ultimately what I ended up going with was what's called the informed consent model, which is just that you say, I understand what's going on, and you basically just self-administer. And what I do is I get blood tests reasonably regularly, once every 6 months or so, and I send them over to my Canadian doctor, and he checks that stuff out, and that's how it works. And he advises me on if I want to change my dosage or something, but in practice, I've just suggested dosages that I think are okay and just confirmed with him whether or not that's okay. And I've sent him my blood work to be like, okay, I'm not like dying of something, my liver's not dying or something like this. So in practice, most of my hormone stuff I've been doing myself. So I've been researching online and reading people's experiences and all that sort of stuff. And with that, it's really important that you look for your information in multiple sources, because there's going to be some sources out there that aren't very good. So you want to try and get the information from, a few different varied reputable sources before you consider, doing that for yourself. And if you can't, then you definitely probably should speak to a doctor. And you should probably, you should speak to a doctor anyway. So, as far as my personal experiences with starting the hormones, I started with 1 milligram of estrofem, which is sublingual estrogen. You put it under your tongue, and 100 milligrams of aldactone, or spironolactone, I think is the generic name. And that's to suppress the testosterone. So the estrofem is the estrogen, and the aldactone or spironolactone is to suppress the testosterone. Another drug that they use to suppress testosterone is sapropterin acetate, I think it's called. Also known, I think, as Androcure. And that one also works to suppress testosterone. I'm actually thinking about switching to it because a lot of people have recommended that one as saying it's more effective. But in any case, I ended up starting with spironolactone simply because it was very widely available and relatively benign as far as side effects go. Whereas I think sapropterin acetate can have more severe side effects, or I think. I'm not 100% sure on that, but if I switch to it, I'll certainly let you guys know my experiences with it. Upon starting hormones, I kind of had this feeling of euphoria. The euphoria, I would say, it kind of can be more or less compared to an ecstasy high on the second day. So, like if you've ever taken ecstasy, like you take ecstasy on the night, and you party through the night, and then the next morning you're still a little bit high, and you're not really high, but you're still a little bit high, and you have that feeling. It's kind of like that feeling, is how I experienced it anyhow. I knew that this was almost certainly the placebo effect, but it didn't seem to change the fact that it felt real to me, the feeling of like being very, a little bit bubbly and a little bit buzzed, and just a little bit of mild euphoria going on inside my head. So that was my experience for about the first week, and then not so much of anything. But I got breast tenderness probably within 3 weeks, 2 or 3 weeks. It wasn't very long. And I was on that dosage for about 3 months, 2 or 3 months, and then I thought, well, I should probably increase it. By that time, I already even had a little bit of breast growth, and I questioned my endocrinologist at the time about, what that means, and he said that it's common to have breast growth only on spironolactone, so it could simply be the spironolactone and not the estrofem at all, or it's anyway. The spironolactone alone has the ability to stimulate breast growth. So I increased my dosage to 4 milligrams of estrofem and 200 milligrams of spironolactone, and that's the dosage that I'm still currently on. I would say it's been quite effective in feminizing my body. There was a little bit of a blip there. About a month in, I decided that I wanted to try injectables. Injectables are still something that I want to try to get on here because I've heard that they're more effective from friends and also from research online. However, the standard injectable is estradiol Valorit, which you inject every 1 to 2 weeks, depending on the dosage and how you're doing it for your own hormone regimen. But I could only find estradiol benzoate, and estradiol benzoate, from the one study that I found, needs to be injected every 2 to 3 days. So I decided I wanted to try it out, and my endocrinologist okayed it. And for estradiol benzoate, you are supposed to inject it intramuscularly. Anyway, supposed to inject it into your muscle, not into your skin, which is subcutaneous. And I had to inject it in my bum. So I watched a whole bunch of YouTube videos and learned how to inject myself in my bum. Went out and bought a bunch of needles for injecting intramuscularly and injected into my bum. And that was super scary because there's this nerve that is in your bum, and if you hit it, you can paralyze yourself. So that was super scary because I was always paranoid that I was going to be hitting it. The second part is that you have to make sure that you're not injecting into a vein. So after you stick yourself with this needle, this big needle, I'm talking like that big needle, like that's not the syringe, like the needle, the metal part is like that big. After you stick this inside you, you actually have to pull the plunger up and make sure that you didn't hit a vein. That's if blood comes out, you have to take it out. So you have to pull the plunger up, make sure you didn't, and then you have to inject it, which actually hurts quite a lot when it's intramuscular. And I was having to do this every 2 or 3 days. I think I made like maybe 3 or 4, something like that. And it was just too much. The pain I think I could have just taken, but the other problem for me was that, at least with the estradiol benzoate that I had purchased, it was so spiky in my hormones. I would get, I guess more or less a PMS-y type effect, where my emotions and everything would just be all over the place from the hormone fluctuations, and I wouldn't recommend estradiol benzoate for anybody who's thinking about injections. I think you definitely need to just try and find the estradiol Valorit. And again, I'm trying to get on estradiol Valorit now and might make the switch fairly soon. So if I do, I'll certainly update as to my experiences with that. Other effects that I started to get after, particularly I noticed on injections because I was getting very high levels spiking of estrogen. You do get more sentimental, I would say, and I think, just sort of more sentimental, and a good example of that would be like I would think about my dogs, and then I would think like, the thought would come to me like, hey, my dogs like are gonna die someday, and that'll be super sad. And then that would just make me like ridiculously sad, and I'd start crying and cry for like 5 or 10 minutes about my dogs. And uh, it's just any small thing could like really set me off emotionally when I was in that state with the massive hormone spikes from the injectables. And I think it's worth noting that even on the pills, the sublingual pills, the estrofem that I take, I do also get a bit of a spike from that, and it can happen as well that I'll get like a little bit emotional or something like that um, because of I'm not sure 100% of course, but I would say it's probably because of the uh, the hormones, the spike in hormone levels. So yeah, that's something that you can expect to happen. At least that was my experience. The other thing is that, like sexually, I definitely, like before I started transition, I had a girlfriend. I'd only been with girls and stuff before transition, and I was genuinely attracted to women. And I guess how to say, I was physically attracted to women, and of course I get along with women, but for me the dynamic of my relationships with women has always been a little bit off, I guess to say. But I knew kind of what was expected of like a man or a boy in a relationship, so that's kind of what I tried to do. But I think I did that to varying degrees of success. But in any case, I kind of have this theory that testosterone just makes you attracted to women, or um, gives you the drive to be attracted to women, I guess. I don't think this is by any means for sure or concrete or anything, because I know that in the past they did some fairly unethical hormone experimentation type things with gay people, with homosexual males and females, and by giving them either testosterone or estrogen. And I don't think that they were able to change anybody's sexuality by doing that. So it's probably a little bit more complicated than that, but at least for me, as basically a very heterosexual person, when I was with male hormone levels, I was attracted to women. With female hormone levels, I'm attracted to men. And that's just, I guess that's just how I am. I'm just heterosexually minded. But what was I trying to say about this? Oh yeah. No. Right, so I was trying to say that I think that the testosterone, for me, or for generally heterosexually minded people, is it kind of gives you that drive to be interested in women, and then in the absence of that, in the presence of estrogen, you have more of a drive to be interested in men. And as my testosterone levels began to fall, I started to lose my interest in women, including my girlfriend at the time. And that was a very difficult adjustment period for me, and for my girlfriend, of course. And yeah, it was just very tough to see this. You're going from a genuine physical attraction to not being physically attracted anymore, and it's just it was a very strange experience for me. And I've heard about this sort of thing being reported before, but when I've heard it being discussed before, or read it being discussed before on online forums or whatever, a lot of times it's dismissed, and people say like, oh, this just means that like you had these like latent feelings and all that sort of stuff. Well, yeah, sure. I think in my case, I definitely did have some kind of latent feelings toward like the general idea of being with a male partner was appealing to me. But as far as the physical aspect of it, like I'm quite sure of myself. I was attracted to women, and I was not attracted to the physical qualities of men, and I am now. And I think it's really important to consider that, when you're going to be getting on hormones, that, this could happen for you. So if you're currently in a relationship, you take it into account and make sure that you discuss it with your partner, all the different possibilities of what could happen. Because in my case, I think I a little bit naively presumed that that wouldn't change, but it did. What else? I think I started, as I mentioned, I started getting some breast sensation or breast tenderness very, very quickly, about a month or so into a very low dosage of hormone therapy. I would say that by about half a year or so on hormones, I had very noticeable breasts. Even right now, my breasts are fairly big. They're certainly, I wouldn't say, I think they fill out like a B cup. So certainly they could be a little bit larger, especially for my frame, but they're definitely there. They're definitely breasts, So, that being said, like I met some other transsexual girls, and one of them had been on hormones for about 5 years and had almost no breast growth. So I think that really just depends. And she was the same age as me as well. I think that really just depends. And yeah, so this video is getting really long. So if you have more questions about hormones or something like that, certainly feel free to post those in the comments. But I hope that this video is reasonably informative and lets you know about maybe what to expect from hormone therapy. Okay, take care, everyone. Bye.